From VOA, Learning English, this is the Health Report. Vitamin D is important for healthy bones and teeth. It may also help to protect the body against diseases such as diabetes and cancer. Now, researchers say vitamin D might help fight brain diseases called dementias. Dementias damage thinking and memory processes, what scientists call cognitive abilities. Dementias are difficult to treat, and the disease is very frightening to those who have it. More than 47 million people around the world suffer from dementia. The World Health Organization reports that 60% of them live in low and middle income countries. Now, a new study in the United States shows a possible link between dementia and low levels of vitamin D. Researchers at Rutgers University in New Jersey are exploring the relationship between vitamin D and dementia. The team recently measured vitamin D levels and cognitive ability in older people. Nutritional Sciences professor Joshua Miller led the team. He said cognitive abilities differed among the subjects studied. He said tests showed that about 60% of the group was low in vitamin D. Those subjects who had low vitamin D levels showed more short-term memory loss. They also were less able to organize thoughts, order tasks by importance, and make decisions. The findings suggest that vitamin D might play a part in slowing dementia. More studies, however, are needed to see if vitamin D supplements can help. The research was published in JAMA Neurology. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. A hospital in the United States says a volunteer firefighter has received the most extensive face transplant on record. 41-year-old Patrick Harrelson received a new face in what is being called historic surgery. The surgery took place at New York University's Langone Medical Center. Plastic surgeon Dr. Eduardo Rodriguez led the team of 150 medics that performed the 26-hour transplant surgery. Hardison waited a year for the perfect donor who had a matching blood type, fair skin, and hair. The donor's face is from a 26-year-old New York bicycle mechanic and cyclist. David Rodabow was pronounced brain dead after a biking accident in late July. Doctors pronounced him dead on August 14th. 2 hours after the donor's death, a team of doctors operated on Hardison, carefully removing his face. Another team worked on the donor. A nonprofit organization called Live on NY seeks transplant organs and tissue in the New York City area. This organization identified Rodabow as a possible donor. He had signed up to donate his organs. In 2001, Patrick Hardison entered a burning house to save a woman when the roof fell on him. He suffered severe burns on his head, neck, and upper torso. Hardison lost his ears, lips, most of his nose, and nearly all of his eyelids. To protect them, doctors covered his eyes with pieces of skin. This left only a small hole for him to see out of. His surgeon says he now has working eyelids, ears, a full head of hair, as well as eyebrows and facial stubble. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. A 26-year-old Californian man almost died recently. The reason is surprising. Luis Ortiz went to a hospital in Napa because of a headache and nausea. Doctors were shocked to find a live young tapeworm in the brain of the university student. The parasite was creating a severe blockage. Doctors saw that the situation was very serious, so they operated immediately to remove the parasite. The tapeworm was still moving after they took it out. Luis Ortiz was saved from death. Tapeworms very rarely infect the brain. They are usually found in the intestines. Doctors do not know exactly how Ortiz was infected, but they suspect food was to blame. Tapeworms can sometimes be found in undercooked meat and dirty water. The U.S. Centers for Disease Control and Prevention says the U.S. has about 1,000 reported cases of tapeworms each year. The CDC adds that tapeworms are more common in developing countries with poor public health systems. Signs of parasite infection include stomach pain, nausea, loss of appetite, and weight loss. Other signs are a lasting headache and vomiting. The best way to avoid a tapeworm infection is to wash fruits and vegetables. Also, make sure meat is cooked thoroughly. The CDC suggests cooking all meats to an internal temperature of at least 63 degrees Celsius. Luis Ortiz has not fully recovered from his illness yet. He has memory problems and other difficulties thinking. He is not yet able to safely drive a car. But Luis Ortiz is not complaining. He says he feels lucky to be alive. For VOA Learning English, I'm Ann Ball.
From VOA Learning English, this is the Health Report. The United States federal government considers marijuana an illegal drug. But almost half of the 50 U.S. states have made marijuana use legal, or only a minor crime. People who support legalization of marijuana say some kinds of the plant offer extraordinary help for human health. For example, one kind of medical marijuana is reported to ease effects of epilepsy, a disease of the nervous system. Maggie Selmeski is 2 years old. She has spent much of her life in the hospital. Maggie has a rare form of epilepsy. The condition can cause a sudden loss of consciousness. It also can produce repeated seizures, periods of uncontrolled shaking. Maggie's parents are Rachel and Sean Selmeski. They say they made emergency trips to the hospital many times in the first year of Maggie's life. Doctors used medicines to save her life. But Mr. Selmeski says the drugs also had other unwanted effects. The couple then learned about medicinal marijuana called Charlotte's Web. It was developed in Colorado, where the drug is legal. The Selmeskis lived in Tennessee, where it is not. Maggie's doctors could not legally treat her with marijuana. So the Selmeskis moved to Colorado. They have treated Maggie with Charlotte's Web 3 times a day for the last year. The Selmeskis say her condition improved immediately. They say her digestion and muscle mass improved. And they say she began to smile more. About 200 families have moved to Colorado in order to treat their epileptic children with Charlotte's Web. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. Aid agencies are warning of a possible humanitarian disaster in Yemen, including severe malnutrition. The agencies say up to 500,000 children lack food or nutrients in their diet. Yemeni hospitals are in need of simple medicines, they say. Al Sabeen Hospital cares for children and pregnant women in the capital, Sana'a. Hospital officials say some medicines, treatments, and other supplies are no longer available at the medical center. The center has no more intravenous fluids, anesthetics, or Valium. In a nearby medical clinic, doctors are seeing a sharp rise in the numbers of malnourished children. More than 500,000 people are expected to suffer severe malnutrition in 2015. Dr. Najiba Ali Al-Qasal says the situation is serious. She says they are facing famine with their children. Aid agencies blame the shortages on the blockade enforced by Saudi Arabia and the bombing of the Houthi-controlled port of Hodeidah. Up to 90% of hospital supplies pass through the port. The aid agency Save the Children provides support to the Al Sabeen Hospital. Their spokesperson, Mark Kay, recently visited Sana'a. Mr. Kay says the blockade needs to be lifted. He says they urgently need these absolutely critical goods. If they do not get them, he says, more children and pregnant women will pay the price. Aid agencies warn that about 15 million people in Yemen do not have a health care provider. They say that could be the deadliest effect of the conflict. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. Millions of people in developing countries live near toxic waste sites. A new study looked at the dangers of living near these chemical waste dumps. An environmental group in New York studied water and soil samples from 373 waste sites in Pakistan, India, and Indonesia. The researchers found that more than 8.6 million people were living near the sites in 2010. Richard Fuller was an author of the study. He says lead, chromium, mercury, phosphates, pesticides, and other kinds of chemicals were found. Mr. Fuller heads the Blacksmith Institute, which paid for the study. The Institute works to solve pollution problems in low and moderate income countries. The study says people living near the dumps lost more than 828,000 years of healthy life from toxic waste exposure. The researchers based this finding on estimates of illness, disability, and early death. They say malaria caused less illness and early death in the same 3 countries, while air pollution caused a little more. The study found that lead created the highest pollution levels. If this metal is absorbed into the blood, it can harm the brain development of unborn babies and lower the intelligence of children. 2/3 of those exposed to lead near waste dumps in Pakistan, India, and Indonesia were children and women of childbearing age. The Blacksmith Institute is studying toxic waste sites in 70 other developing countries. It hopes to help organize cleanup efforts. Richard Fuller says the countries he is working with want to cooperate. It's just going to take a lot of work. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. The World Health Organization reports that hundreds of millions of people have mental illness but receive little or no treatment. A new WHO report finds that very little of healthcare money goes to treating mental conditions. The WHO's Mental Health Atlas 2014 is the most complete look at the state of mental health around the world. It contains data from 171 countries, representing 95% of the world's population. The atlas says that mental conditions are responsible for about 10% of the world's health burden. That means 10% of all people have a mental disorder. However, only 1% of healthcare workers worldwide is working in mental health. The report finds every country, area, and age group suffers greatly from mental disorders. But total spending on mental health is extremely low. It also says very few nurses and other healthcare workers want to work in the mental health field. People of all levels of society can suffer from mental illness. However, the Atlas finds that the financial and healthcare divide between poor and rich countries is very wide. The report says there is, on average, one mental health care provider for every 100,000 people in poor and middle-income countries. It notes poor countries spend less than $2 per person each year on mental health. That is compared to $50 spent on mental health per person in rich countries. For VOA Learning English, I'm Jonathan Evans. Dementias. Dementias damage thinking and memory processes, what scientists call cognitive abilities. Dementias are difficult to treat, and the disease is very frightening to those who have it. More than 47 million people around the world suffer from dementia. The World Health Organization reports that 60% of them live in low and middle-income countries. Now, a new study in the United States shows a possible link between dementia and low levels of vitamin D. Researchers at Rutgers University in New Jersey are exploring the relationship between vitamin D and dementia. The team recently measured vitamin D levels and cognitive ability. From VOA Learning English, this is the Health Report. Vitamin D is important for healthy bones and teeth. It may also help to protect the body against diseases such as diabetes and cancer. Now, researchers say vitamin D might help fight brain diseases called dementia in older people. Nutritional Sciences professor Joshua Miller led the team. He said cognitive abilities differed among the subjects studied. He said tests showed that about 60% of the group was low in vitamin D. Those subjects who had low vitamin D levels showed more short-term memory loss. They also were less able to organize thoughts, order tasks by importance, and make decisions. The findings suggest that vitamin D might play a part in slowing dementia. More studies, however, are needed to see if vitamin D supplements can help. The research was published in JAMA Neurology. For VOA Learning English,